Hi, I'm Dr. Tejas Patel and I'm a dentist here in Austin, Texas. I just wanted to take a few moments and introduce the video that you're about to watch. The video you're about to watch reviews a couple of photos in regards to several cases that we've done using dental implants. I'll go over what the patient presented with, their desires, their wants, and how we achieved the result that they wanted in the end. And the main reason I wanted to share this information is so people start to understand the steps involved with dental implants and so forth. So if you have any questions about dental implants and the procedures or anything that you see in the videos, please feel free to call us at 512-263-8337 or visit lakewaysmiles.com. Thank you for watching, enjoy the photos, and have a great day. Here's another case that we have decided to do dental implants for. Our patient was most concerned about her smile, and the thing that bothered her the most was on how on the right side of her smile, her smile was not full. So she wanted to have implants placed to fill out her smile. That was her main concern. That's what bothered her the most about her smile. So when creating a game plan for her, we addressed her main concerns. Here's like a view of the chewing surface of her teeth. And so again, you can notice on the right side, she is missing quite a few teeth that we're gonna finally place 2 implants to help support a 3-piece bridge that will help replace her missing teeth on the right side and therefore fill out her smile as she's designed. Here's an image of a few months later after the implants were placed and the gum tissue adaptation around the healing caps. Again, this is after the implants were placed. We've waited 3 months and then we will start the process to place the teeth on top of the implants. Here's an overhead or view of the chewing surface of the teeth, and you can notice how we've placed the implants in a porcelain permanent bridge over the area to help fill up the space, replace the missing teeth, and fill out her smile. Here's a picture of the final restorations on the upper right side, and you can note how, again, the patient at the beginning was concerned about her smile on the right side and how her smile was not full. And now with the placement of implants and the permanent crowns on top, her smile is nice and full on the right side, and she just has a nice, brighter, fuller smile, and a smile that she's very, very happy with. So the patient is presenting with missing a lower left molar, and here is the process on how we replaced it. So here's an x-ray of the area before we've done any type of surgery, just to help evaluate the consistency of the bone and actually also to take measurements of the adjacent teeth and also any anatomical structures that we want to avoid. In this case, we've used the surgical guide to help guide the placement of the implant. Surgical guide was created with the use of the CT scan to help guide the exact position of the implant to avoid any vital anatomical structures and to predict the exact placement of the implant. So this is just the CT scan based surgical guide being tried in. So in this picture we've actually created the hole or space for the implant to be placed in, and the purple instrument you're seeing is called a guide pin, which helps us just verify the accuracy of the placement of the implant and just to ensure that we're at the right angle and depth and so forth. So this is just called a guide pin to ensure the accuracy of the placement of the implant. Here's an x-ray taken during the middle of the procedure to ensure the implant is going into the right position. So this is the purple instrument or the guide pin in place, just to again verify the correct angulation and placement of the implant. Here is an image of the implant. The implant has actually been placed. It's been placed below the level of the gum and actually slightly below the level of the bone. Here's the actually final placement of the implant with several measurements we've taken on the x-ray just to verify the correct positioning and placement of the implant. Since we were able to use a computer-guided surgical guide for the implant placement, we did not have to use the use of stitches or sutures to affect the gums. So this is actually called a flapless implant surgery, where the picture you're seeing is how the patient left the office with the implant in place without any stitches or so forth. This actually improves the healing time and improves the post-op effect of the patient.